and welcome to another episode of Spotlight on Health. I'm your host, Dr. Stephen Eschenauer, the Health Officer at the Kanawha-Charleston Health Department. And today we have a very special guest and long-term friend of mine, Dr. Bill Carter. That is the Dr. Bill Carter, the cardiologist that has been here in the Charleston area since 1970. He has taken care of innumerable patients and family here in our community, and I want to welcome Bill to our show today. Bill, welcome.
Well, thank you very much. Happy to be here.
I'm very glad you're here.
Yeah.
So I know Bill from a lot of our hunting experience. Met Bill many years ago. Actually, when I was a med student was when we first met each other in 1994. I don't know if you remember. You probably met many med students back then, but that was actually the first time I ran into you at a place called CAMC Memorial Hospital. Yes. And Bill's been a very avid hunter that has come out to our farm to hunt birds, for close to 20 years. And today we're going to talk a little bit about heart-healthy hunting and why it is so important to take care of yourself, take care of your heart, so that you can continue in life and in retirement with hunting and doing the activities that you really enjoy. So, Bill, tell me a little bit about what your experience has been as an avid outdoorsman.
Well, I just sort of grew up with my father in Virginia. We had bird dogs and we hunted a lot, hunted with my brother a lot. I've always hunted throughout my medical career in different places I've been, North Carolina and Charlottesville, and it's been it's a great part of my life, yeah.
Mm-hmm. So essentially since childhood you've been been a hunter.
Sure, I grew up with bird dogs, English setters.
Oh yes, and as many of us know that have bird hunted, it's a very active sport. So you need to be in shape if you're going to chase those bird dogs around the field.
Yeah. I mean, you do a lot of walking. I mean, you keep active.
Mm-hmm. And these many years later, if you don't mind me asking, how old are you now?
I'm 87.
87.
Yeah.
Can you believe that, folks? Bill is 87 years old and still in incredible shape, a very active outdoorsman. So, Bill, tell us a little bit about what has been the keys to your success to keep you in the physical health you needed to be in to continue to be a sportsman.
Well, I used to do more sustained exercise, in my fifth and sixth, seventh decade, where I would really vigorously train on a bike or swimming laps or something on a periodic basis. But since then I just I do a lot of walking when I hunt, and I'm not in super shape, but I can certainly hunt 4 or 5 miles without any trouble.
That is excellent. Still out up and down the mountains for 4 or 5 miles on a hunt. That is excellent. So let's talk a little bit about the specialty that you dedicated your life of medicine to, and that was cardiology. What are things that our guests can do to take care of their heart?
Well, we all know, I think most people know what we call the risk factors. What is it that statistically increases your risk of having something bad happen, like a heart attack or heart failure or dying suddenly? And I can go through the list of things. I'll put number one in my feeling is the tobacco use. It's been incredible since the Surgeon General's report came out, I believe, in '83. That started a lot of public health education. It was amazing that within 10 years, the incidence of male smoking decreased from 50% down to 25%. Now I think it's below 20%. So, and it's more in the less educated people that are still smoking. People have not really embraced the importance of not smoking. Nicotine is a very deadly drug for many people. Now, we all know, Uncle Joe, he smoked until he was 100, and he never died. Well, yeah, Uncle Joe was lucky, you know. You play Russian roulette, it may not fire, but you're playing Russian roulette when you smoke. And it's markedly decreased not only heart, and I used to tell my patients, you know, if you have a heart attack, you're lucky. Eat all the cholesterol you want and hope you don't have a heart attack, because it's a hell of a lot better way to die than cancer or COPD when you're on oxygen the last 5 years of your life. So if you want to die, die quickly. You know, don't drag it out with cancer or lung disease or stroke.
Yeah. So the biggest factor that you've seen as far as risk factors to decrease your risk of heart disease is to stop smoking.
Yeah, and heart disease is not just heart disease; it's stroke and cancer and and lung disease that's so debilitating.
Yeah.
You wish you were dead sometime. I'm concerned now that we've got these middle school, almost pre-middle school kids are vaping, and a certain percentage of them are going to be smoking when they're 50, and they're going to be getting dying in their 50s of reversible, preventable diseases.
Yeah. That's the key to it is how preventable those diseases are by just not smoking.
Yeah.
Yeah.
In education, I think people think vaping's safe, but any nicotine is addicting. It's a highly addictive substance. And I don't know, we don't have good data for 50 years for people that start vaping like we see now. But any kind of smoking, whether it's vaping or just regular tobacco, cigars, chewing, anything, it's addicting.
Yes. Oh, absolutely. It is definitely one of the most addictive drugs that we know of, especially of legal drugs. It's probably the most addictive.
And it's hard to get people to quit, even more so in my experience in women, that they're more probably concerned about their weight, and they stop smoking, they gain some weight, and it's just a very hard and difficult habit to break.
Mm-hmm. Let's talk about a few of the other risk factors that individuals that may have them, or what they can do about them, like high blood pressure and its effect on the heart.
Right. Well, high blood pressure is clearly a risk factor, and you know, it's partly related to our diet. We eat so much sodium and salt in our diet today that increases our blood pressure. But most of the people in our society, you're 60% chance of having high blood pressure. You're 70, you got a 70% chance. Most of us, because of our lifestyle, have to take something for the blood pressure. Mm-hmm. I take something for mine, but it's if I had a perfect lifestyle and didn't eat any salt and things, I may not need it, but I need something for my blood pressure. Mm-hmm. It's easy to treat, you know.
And that's the beauty of hypertension or high blood pressure, is that it normally is easy to treat, but it does take some management, actually seeing your physician, following your blood pressures, getting them checked, and getting them optimally treated. So following up with your physician to get that management done is very important. Let's talk about cholesterol. It's especially an issue with our diet today of how much fats and cholesterol we have in our diet.
Right. Well, you know, cholesterol is clearly a risk factor, and the higher your cholesterol, the higher your risk. There's no argument about that. And you know, the experts have changed since when I was in training. Everybody run around drinking corn oil and thinking we're unbalancing the saturated and the polyunsaturated fats. And now the experts don't seem to mind eating eggs. And when I was in training, if you ate more than 2 or 3 eggs a week, you were playing Russian roulette. So, you know, science is a fluid discipline. You know, what we say one generation may change. We have to practice in the way the best information we have. People don't understand that. They think science is set, and we're always learning and changing sometimes what we thought we knew to something based on new evidence that changes what we do. But clearly, I think, you know, the saturated fats, particularly and heavy, you know, creams and milk and things like that, and increases your risk some. But I think it's in compared to hypertension and tobacco use, I think I'd put it number 3. But it is a factor. Certainly, if you have a really high cholesterol, it's easy to treat now. You can take a statin drug and get your cholesterol down.
Any idea of what percentage of patients that you saw with cardiovascular disease, in specifically blockages, coronary artery disease, had 1, 2, or 3 factors?
Oh, I would say a high percentage had at least one. And of course, we haven't mentioned the big elephant in the room is family history. I mean, there's some families that do everything right and they still have heart attacks. There's some people that do everything wrong and never have a heart attack. But you're increasing your risk, particularly if you smoke and have high blood pressure. But diet does play a role. And being overweight, mainly because of the fact that if you're overweight, you're much more likely to get diabetes. And diabetes is a huge risk factor.
Oh, yes. Yes. Yeah, we've seen a lot of diabetes earlier and earlier in our youth.
Right.
Many kids in high school already being diagnosed as being diabetic.
Right, and because they're inactive now, they're not exercising like we used to be in the playground all the time and running around town. You know, a small town I grew up in, we're just running all over the place. You know, so we do have a generation of obesity.
Yes.
And diabetes is not a good thing to have. Even though it doesn't make you feel bad when you're just non-insulin dependent diabetes, you don't have to get shots, you just take a pill and you get your sugar okay. But it markedly increases your risk of having a heart attack.
Why is diabetes a risk factor for heart disease?
Well, you know, it's again, there are many related activities of diabetes that affect your fats. It affects the vascular tone. It affects your blood pressure, actually. They're all interrelated, but it's you know, the exact mechanism by which diabetes causes heart disease, I'm not going to be able to give you a good scientific example. I'm sure there are plenty of them around, but it's not a good thing to have.
No, but we do know that there's definitely an association between diabetes and heart disease.
Yeah, and we think it's causation too. I mean, diabetes does, and a lot of it may have to do with the obesity and the risk factors that go along with it. But diabetes is not a good thing to have.
No.
And part of that's just bad luck. I mean, some people can eat all the wrong things and not get diabetic, and other people with minimal indiscretion get diabetes.
Yes.
You know.
Fortunately, there are some new medicines out there that are really helping to control diabetes, and those have become very popular as of late. And I think the jury is still out on those effects long term.
Long term, right.
But we've definitely seen a lot of weight loss from those medications, as well as improvement of people's diabetes.
From the very early days, metformin, which was one of our first medicines used a lot for diabetes, it caused loss of appetite and weight loss, and the newer ones are even more so. But I'm a little concerned about, we don't know what the 10 or 20 year, look how long it took us to learn that smoking was bad. So we may have a generation that have been on these medications for 30 years and suddenly find, gosh, they've got a higher incidence of something bad, maybe cancer, maybe, who knows, maybe nothing, maybe fine, I don't know.
Yeah, we never know. So one of the benefits of you taking good care of your health over the years, and obviously seeing many of those who had not taken good care of their health, I'm sure it was an encouragement to you to exercise, get your blood pressure under control, and take good care of your health. What should patients do today that have risk factors such as smoking, high blood pressure, high cholesterol? What kind of regimen would you recommend to them as far as a relationship with their physician?
Well, I think it's important to know what your numbers are, to see a physician, get the options of different ways to manage, whether it's diabetes or your high blood pressure. Smoking, that's easy, you just should stop. I mean, it's crazy to smoke. I used to not tell my patients, don't cut down your tobacco, just stop it. It's just, and I think the vigor with which I said that, and the fact that I had the advantage of being a physician who had seen a patient have a heart attack and they were scared, man, they would quit. Now, it's hard to get somebody who's well to quit because they're not scared. But once they get a heart attack, you'd be surprised. Most of my patients would quit very quickly. But it's difficult when somebody feels well and they don't have any disease, so they wait until they have sudden death. You know, 1/3 of people that die of heart attacks, 1/3 of them, their first manifestation of heart disease is sudden death.
Yes.
So it's a little hard to start managing your risk factors after you have sudden death. So you shouldn't wait until that. That's what my father died of sudden death.
And how old was he?
He was 52, and our house was full of smoke. He smoked Campbell's. His diet was typical of the 50s at that time, and it was just extraordinarily common to have people in their 50s at all different walks of life. Executives were popping off in the 50s of sudden death, and the companies started recognizing the need to try to not just treat heart disease and treat risk factors, but prevent them from occurring. Mm-hmm. And that started the clinics, wellness clinics and things that have been very helpful.
Oh, absolutely.
Yeah.
Yeah, as a physician, I've treated, as an emergency physician, treated many heart attacks like you have, but it is very unfortunate. They call it the 1 in 3 rule. Approximately 1/3 who have a heart attack don't make it.
Yeah, right.
Their first event is the fatal event.
Right.
1/3 have significant heart damage from the heart attack, damage to the heart muscle itself,
right.
a good bit of which may be permanent, and then 1/3 do recover most of the way. But nonetheless, nobody gets away unscathed.
Right.
So yeah, it's hard to moderate your risk when you've already had a heart attack and died from your first event.
Right.
You can't really go back.
Right. And, you know, quality of life, you know, people say, well, why do you exercise? And, you know, I said, well, it's not so much to live longer, it's to feel better when I'm living. And if you're physically fit, then I can play tennis with my younger friends. I can hunt with my younger friends and keep up with them. That's quality of life. And whether I live long or not, that's nice. But, you know, the quality of life's more important to me than getting another 10 years out of my living.
Yeah, absolutely, the quality over quantity.
Yeah.
Yeah. But in this case, the quality also gives you quantity, that quality of living. So many in West Virginia are sportsmen like yourself, like what I like to do, and having grown up since childhood, we like to be able to get out into the woods, to take our kids out, to take our grandkids out. I feel that when I talk to patients about quality, that by taking care of yourself, you are giving your children and your grandchildren the opportunity to share with you these experiences. It goes beyond just you.
Right.
It's about your whole family.
Right.
What happens if you do pass away young? I'm sure that you missed your dad with him passing away at such a young age. How much you didn't get to do with him.
Right.
And here you are at 87, and how much you've been able to do with your children and grandchildren over the years, and teach them bird hunting and the joy of getting out into the woods and really enjoying some quality life. It's nice that we can do these things at this stage of life.
Sure. And, you know, people say, well, you're taking a risk. Well, yeah, there's a risk in anything you do in life. I mean, my goodness, I stay home and be safe all the time. That's not much fun. I mean, if I die in the woods hunting, worse things can happen. Mm-hmm. I think people quit doing things that they like to do, sometimes because they just don't like to do it because they're no longer good shots, or they can't hit the tennis ball as well. They quit doing things because they were always competitive, and now they can't do well. And that's just too bad, letting your ego keep you from going out and enjoying the camaraderie, the social. And studies have shown social interaction is so important as you get into my years of not being isolated. And keeping the social contact with people you used to hunt with, maybe younger people that you hunted with. Try to keep that up if you can. Fishing, fly fishing, things that or any kind of fishing is whether you're exercising or not. It's just the quality of life, the camaraderie, the social interactions. These have been shown to clearly increase people's lifespan.
Oh, absolutely. I tell people that there was a gentleman that many years ago knew a few things about physics, and his name was Newton, Sir Isaac Newton, and his law on motion: a body at rest tends to stay at rest, and a body in motion tends to stay in motion. So when we stay in motion and we get out and we interact with others and we live and enjoy life, we can continue to do that. But when you just go home and sit and rest, soon that's all you can do is sit at home and rest. And that is so sad to see. I'm sure you've seen that as a physician. I know I've sure seen it as a physician, that sometimes when people retire and they just decide to sit, in a few years, that's all they can do. Right. And the importance of getting out and being able to do some heart-healthy hunting, to be able to follow up with your physician, control your risk factors, and participate in the activities that you really enjoy in this life.
Right.
And living that quality.
I think, a lot of us have been brought up to be competitive, sort of, whether in graduate school or med school or whatever, sports. And as we get older and we're not as good as we used to be, some people just don't have any fun because they can't hit the birds with the shotgun like they used to, and they miss all the time. To me, that's unimportant. I could care less whether I get a bird. What I enjoy is like taking my grandson hunting and or just being out and seeing my bird dog work. I get more joy out of that than myself killing any bird. It's just being with my dog. And the joy of that, to me, is worthwhile whether I hit anything or not.
Yeah. And that time spent.
Yeah.
That time spent, whether it's sitting on a creek bank fishing or being out in a river and fly fishing and working those rapids, or being out in a field with your bird dog, those are just priceless memories and moments. And priceless for your grandchildren as well. Look at the example you've been for your family.
Yeah.
I want to see that for all of our patients, all of our citizens, to have that opportunity to be so active and be involved and in the lives of their children and grandchildren. It's been a journey in this life, having a grandparent that taught me to do many of these things, as you've taught your children and grandchildren. My grandfather used to take me out and we would hunt, we would fish, and he would show me so much. But what I remembered even as a child, that he went to the doctor. I remember when I was very young, he quit smoking. His doctor told him, "You need to stop smoking." Never saw him smoke again the rest of his life. Lived another 20 years. So, as I've learned, we each have a responsibility to take care of ourselves, to follow up with our physician, to adopt some healthy life habits so we can limit those risk factors and live a quality life.
Right.
Yeah. So what are any other pearls that you have for us in the closing of our show?
No, I don't think so. I think we've covered things, I hope, pretty well. But I think the quality of the life is the most important, and keeping in contact, social contact with people, it's a joy to be out.
Mm-hmm. You've been an inspiration, and your reputation in this community has been incredible. All the thousands or tens of thousands of patients, I would say, that you've treated over the many years of service to our community, caring for our patients, but your life itself as a testament of how to take care of yourself, that you lived that life. You didn't just tell your patients to do it, you did it. And you're still doing it at 87. That is truly remarkable. Do you have these conversations with your children and grandchildren about how to get the best of these golden years?
Oh, I think the best for teenagers is not to preach to them too much. Let them observe. They may not think about it at the time, but they get older, they'll remember. I hope that grandfather kept active and seemed to enjoy life and got a little bit more mileage. And I hope, that I do. If I ever saw them smoke or vape, boy, they'll know about it.
Absolutely.
And they'll remember my laying into them on that, because that's just crazy.
Yeah, unfortunately it is, because the lifelong consequences that they may not even realize that they are doing to themselves.
Well, when you're 18 or 15, you're not thinking about, you're 55, parents you're having to take care of, your kids are teenage or college, and you suddenly come down with cancer of the lung because you smoked, or a heart attack and you have heart failure and you're disabled. It's not a nice way to have to spend your 50s and 60s because you started smoking when you were in middle school, getting addicted to nicotine.
Yeah. So to all of our guests, probably the biggest thing that you can do to help yourself and give yourself to your family is to stop smoking. That way you can do some heart-healthy hunting. You can be able to go through the mountains, bird hunt, deer hunt, squirrel hunt, fish the streams, walk the rivers, and enjoy the beautiful state that we live in. But even more importantly, to be able to, for you to be there to spend time with your children and your grandchildren, to be an example to them, to be a teacher to them, and to show them the life that they could live. Your example will do an immense good for those patients, or for your family. It's been a pleasure to have you with us today, Bill.
Well, it's been fun to be here.
It's been an honor to get to know you and to hunt with you over the years. And I encourage all of my patients to see their doctor so that you can do some heart-healthy hunting. Guys like Bill, they're not scary, but they can take really good care of you. And we have a lot of good physicians in our community.
We sure do.
We sure do, yes. So I want to thank you very much for joining us today, and I wish all of you a very fun, a fruitful, and enjoyable fall hunting season. Stay healthy, stay active, and make an appointment with your physician today. Thank you very much.